Hello, dear friends. My name is Sofya Dorinskaya. I am a psychiatrist, the head of the Center for Medical Information and the School of Mental Health. Today, I want to answer questions that came in after my recent videos, and specifically the question about olfactory disorders after COVID. No one has fully studied this to the end yet, but logically, from anatomy and physiology, it is clear that olfactory disorders are related to the malfunction of specifically the nerve responsible for the sense of smell. And here it is assumed that first of all, the function of the receptors is disrupted, which is natural and understandable since there can be severe inflammation in the nasopharynx. There may also not be any obvious inflammation, but it is clear that the virus is so active that, in a manner of speaking, it actually burns out these receptors or the tissues around them. In any case, the receptors are affected. There is also an assumption that the function of the olfactory center in the cerebral cortex is disrupted, and that is why a person loses their sense of smell, which causes a lot of suffering for people. Let's consider what this could be. It seems to be similar, by analogy, to neuropathy, that is, a disruption of innervation, a dysfunction of the nervous system, one of the causes of which is inflammatory diseases. But this neuropathy itself arises from a complex process. If we take a moment to go back to the very beginning of the condition, and if we start from the fundamental idea that during a period of illness, the human body undergoes various changes. Seriously depleted a certain group of nutrients, or the person initially had hypovitaminosis, for example, or some kind of deficiency related to this group of nutrients, and the body, having thrown all its resources into fighting off a severe attack, well, it ended up completely empty, so to speak, left in a state of vitamin deficiency. What is this group of substances? It's the B group. It's the group of B vitamins. And what exactly can be recommended here? Assuming and thinking about this, of course, you should take simply B complex. These are capsules. Yes, they're actually called B complex. 2 or 3 capsules a day should be taken. And I want to say once again, everything really depends on the specific degree of depletion that has resulted from this incredibly severe attack. There is absolutely no need to panic. And there is certainly no need to rush into anything right now. To psychiatrists, nowadays psychologists are also prescribing various psychoactive substances left and right. Understand that this is normal. Understand that the body simply needs time to recover. Including nerve tissue, it also recovers, but only under certain conditions. If the body has an ample supply of necessary resources, and an absolutely fundamental component of these recommendations, which is an essential condition for the body's full recovery, is that everything is sufficiently and consistently provided. Nutrition. First and foremost, this means meat. Dear friends, including colleagues who write to me saying that plant-based protein is very valuable. Plant-based protein is not valuable. First of all, some plant proteins do contain essential amino acids. But first, you need to carefully select such a diet. Second, the way these amino acids are present in plants, in plant components, the human body may not be able to absorb them. It is specifically from meat that both essential and non-essential amino acids are absorbed by the body very easily. That is why meat, organ meats, and to some extent fish, though not a full substitute for meat, as well as fish raw, are true sources of exactly this. Protein is the most important thing here, and it is easily accessible. The body doesn't have the strength to extract it through extremely hard work. Amino acids from plants. Plants are only needed for the gastrointestinal tract, so that it works well, and so that the food bolus moves along as it should, as a supplement to food. I'll tell you even more. Illness, especially of moderate to severe degree, will most likely lead a person to vitamin deficiencies. With vitamin deficiencies, plant proteins may in principle not be absorbed at all, especially when we're talking about vitamin B deficiencies. Because vitamin B group includes nicotinic acid as well. They are absorbed. Moreover, if for some time a person has been on a restricted diet, couldn't eat, or was in intensive care, and so on, then the intensity of digestive enzyme production changes in that person. So, if you also load them up with greens, then nothing at all will. The person will simply remain hungry. That's exactly why, after an illness, the diet must definitely include plenty of meat. The meat component should also include concentrated broths. The meat component should be prepared in a dietary way, that is pureed, not fried, not fatty, and so on. In other words, to reduce the load on the digestive system by serving small portions, very often so that the digestive organs can function, so that the external secretions work. For example, if something has accumulated in the stomach, secretions accumulate in the pancreas and they are released regularly in small portions. Bile accumulates in the gallbladder and it is also released regularly in small portions. They are secreted. So what we have accumulated then needs to be released into the lumen of the duodenum, and this is a huge load on the digestive system. You need to eat frequently in small portions. And meat, there's no way around it. There's no way around it. You need to eat meat if you want to recover. If you want to know more about this, let me remind you that we are restoring knowledge about hypo and avitaminosis. And now we have 3 restored books by Professors Lepsky, Avitaminosis and Hypovitaminosis, Avitaminosis in Childhood, and Introduction to the Clinic of Hypo and Avitaminosis. Dear professionals, if you want to know more about this, please read scientific literature. I would also like to remind you that I have published 2 of my own books, and in the second book there is a chapter about what is currently disrupted in our way of life, which can lead to serious consequences. This chapter can be found in this book. If you want to learn more about my perspective on human mental health, if you want to know more about how to restore and maintain mental health, including information about nutrition, please, these books are available for you to purchase in bookstores. These books are available in bookstores and in our own bookstore, and these particular books are published by us, and you can purchase these books from us. I hope I have answered your question. Please put this into practice. If you run into difficulties, if something doesn't work out, or if you have even more questions, please come to the Medical Information Center. We will work with each person individually. We don't work according to guidelines. We don't have well-trodden paths that we follow. Our thoughts only run, you see, in the way someone else has written for us. We work according to a system that was described by Soviet doctors, the one I was taught by. To think about each case, to treat the patient, to treat relationships, to approach a person as an individual case. We consider your case comprehensively and we give recommendations specifically for you. And we explain why you in particular need to do this, that, and the other. We only work individually and we focus solely on what we are dealing with right now. Well, on what we are currently working on. Not on what someone else wrote for us, some lengthy recommendations. And we, it's like this. The person is here. We are somewhere else. There are some recommendations and we just sit there mindlessly doing something. No, we work with each person individually. This was Sofya Dorinskaya. All the best. Goodbye.